Hi, Jim Blodczyk of the Benefits Group here, and happy to report that we're talking about your open enrollment for August 1st this year, and everything will take effect then. Some great news. Your health plan with Geisinger Health Systems will not be changing. And so also, another more great news is there has not been a rate increase. So therefore, Endless Mountains Health Systems is not changing what you're paying for the cost of your health care. So there are no changes to your health plan. And if you said, you know what, I don't want to make any changes to my health plan, you really don't need to listen anymore to this video. You can if you want to, but you don't need to. But you will need to go into the system, the rest of the Bernie portal system, and do the elections for your health insurance for this upcoming year. This is, we think, the last year you'll need to actually re-elect benefits if you're not making any changes. We think next year we should have the technology available, so if you want to just stay where you're at and not change anything, it'll automatically populate it and you'll be done. But this year you do need to make those elections. So we're going to talk about the two health plans that are available, one being the extra plan, which most of the employees are in, and the PPO plan, which some of you are in. And we'll talk about what the differences are. We're really going to focus on the extra plan, mainly because that's where most of you are. So if you currently have coverage, you can make a change. You can add, from one plan to the other, or you can drop coverage if you want to, or if you didn't elect coverage last year, you certainly can elect it for this coming year. Again, these changes will take effect August 1st. If you're a new hire, you're going to have plenty of choices. And so we're going to talk about that. So understand, we're going to talk on some terms in here. I'll hopefully explain them if I remember, and we'll go on from there. So we're going to talk about your Solutions Extra plan. Need a drink so I can talk some more. And so the Solutions Extra plan and the PPO plan are very similar. And so where they're different, we'll talk about it, but everything we're going to talk about is the same. $5,000 deductible, same for both plans. $10,000 for the family. And then there's no co-insurance, meaning once you met the deductible, everything's covered in full, unlimited. You're going to see this maximum out of pocket of $81.50. What does that mean? Well, that means if you hit your deductible and you have all these different office visit copays of $25 or $10 if it's a primary care that's in the system for what Geisinger calls their extra plan. It's a $10 office visit. If it's a traditional just PCP that's not in their extra group, then it's $25. It's $50 for a specialist, and we'll talk about that in just a minute. But if all of those added up to $81.50, then you don't pay any more copays, whether it's prescription or anything else, towards the cost of your health care for the remainder of the year. The plan year, August 1st through July 31st. So again, this copay, though, is slightly different than the PPO plan. We'll pop over here real quick. You'll see the PPO plan. Oh, wrong one. PPO plan is a $25 office visit and a $50 specialist. Same $50 specialist for the summary, the extra plan. It's just that the only difference is if you use an extra primary care physician, and it's limited in Susquehanna County. I think there's just one over in Forest City. There's some in Scranton, of course, and Luzerne County. It's $10. So that's the difference between those two plans there. All the rest of this is the same. Preventive care. These are government mandated benefits, and they're covered 100%. So Pap smears for women, and colorectal cancer screenings, and mammography, and those types of things. Diabetes care. Again, these things are all covered 100%, not subject to deductible. But we're going to just bounce down through here. Again, here's that specialist office visit, $50, same as the other one. Maternity care. Hospitalization for it is subject to deductible, both plans same way. Aftercare, it's covered 100% for your physicians and your baby, okay? Hospitalization, that's where the deductible applies. Remember we talked about it was $5,000? Well, your plan through Endless Mountains Health System has what's called an HRA, Health Reimbursement Arrangement. And this HRA will help cover that deductible. So you, as the employee, have a $5,000 deductible, or only you're paying the first 1,000 and the last 1,000. In the middle, the 3,000, Endless Mountains Health System is paying. If it's a family, you're going to pay 1,000 and 1,000. But again, the middle 3,000 of both the deductibles for your family or for you is covered by Endless Mountains Health System. You're picking up the last 1,000 of each. So where does the deductible apply? Doesn't apply to office visits, specialist or primary. Doesn't apply to prescriptions. It applies, well, inpatient services. You're hospitalized. Outpatient surgery. Those types of things are covered as well. I'm not touching on everything. This document is on Bernie Portal. You can review it if you want to. Eye exams, again, the eye exam is available through the VSP, which we talked about in another video, through the Geisinger, the Guardian, excuse me, too many G's. And that can certainly listen to that if you want to find out more about the vision benefit. Diabetes supplies, we're going to just bounce over this. Again, your copays here are going to be pretty similar to what your copays are on your prescription plan. Looking for the prescription, we're going to just jump down to there. Must have been what I saw up here. They moved it around on me. So your prescription is the same as the diabetes. Oh, there it is right here. Prescription coverage, but it should be, where the heck is it? I apologize. They moved it on me. Here we go. Yeah, it's the same. Generic, $20. Tier 2 is name brand, $40. $60 for non-formulary medications and specialty medications. So again, no changes. So mail order is available for 2 flat copays for a 90-day supply. Some generic drugs are a 0. So if they fall into that plan, the deductible, there is no deductible for the drug plan. It does not apply to that. And if you need chiropractic, it's $25 copay, not subject to the deductible. Maximum 15 visits per benefit year. Again, none of these are changes from last year. So if you're not too concerned, great. If you have any questions, you may call our office, 570-586-1859, and somebody will help you. Again, or go on Bernie Portal, click. There's all kinds of numbers everywhere to get in touch with us. Or if you want to look at this document, it's online. Click that. It's a PDF. It'll load, and you can print it if you want to. You can share it with a spouse. Your spouse or loved one could watch this video as well. So feel free to share that too. And so really, what is the difference between the PPO plan and the solutions plan? If you notice, solutions plan only gives coverage inside of the Geisinger network. Geisinger network is not just Geisinger, of course. Endless Mountains Health System is in the Geisinger network. So it's only the network of the Geisinger health plan. And if you said, man, I want to be able to go to New York City, or I want to be able to get services in Binghamton, this plan will not cover that. But the network is pretty large. The network does include Thomas Jefferson in Philadelphia, Children's Hospital in Philadelphia, of course, the Geisinger Danville facilities in there, Johns Hopkins in Maryland. So some great facilities for some serious conditions are in the network, so they're in it. But if you said, I want to be able to go to New York City for my care, this plan will not cover that. And if so, that was where the PPO comes into play. This preferred provider is the same exact network as this side. So that's why I said it's the same thing there. It's if you want to have access to be able to go out of network, then you need this plan. Understand your deductible is higher, and Endless Mountains Health System does not have an HRA for this side of the house. So you would be responsible for the full deductible. You would be responsible for the coinsurance. And there is no out-of-pocket maximum under this plan. So meaning that whatever they charge, you could be subject to. So understand it's available. And I think that's probably the way most of you are taking the extra plan only, because if you look, these are the copay. These are what the deductions are from the plan. So it's $52.96 as a single for the extra plan. If you want the PPO, it's $68.66. So and so on and so forth. Again, these numbers are in the system, and you don't have to memorize them. But and of course, you could pause this video if you want to look at this longer. But the Burning Portal has these numbers. And those were per pay deductions. But again, choice is yours. Now's the time to make your choice. Whatever you elect, you will stay in for the remainder of the plan year, which is August 1st through July 31st. And you need to, you'll have to continue with that. So anyway, if there's any questions, you may call our office, 570-586-1859, and someone will help you. So we appreciate everything. We love working with Endless Mountains Health System. It's been 25 years plus we've worked with you. And we're happy to serve you. Thanks, and have a lovely day.